parents remember my career choices as a child. They included spy, teacher, ballet dancer, nurse, and cowgirl. In church, I learned I am my brother's keeper, I am my sister's keeper. Those words captured my imagination. My cousins were nurses, and shows like MASH, Emergency, and St. Elsewhere pretty much sealed the deal and really reveals my age. Being a nurse is central to what my parents taught me about patriotism as a child. Working hard, contributing to your family, community, and country. And if you stumbled, someone would have your back until you could get on your own 2 feet again. As my father was laid off 8 times when I was growing up, we knew something about this. Accepting funding for healthcare expansion is that kind of common sense patriotism. Really, it goes to the heart of who we are as a commonwealth. Are we the kind of people who stand back while others struggle?
No.
No! Or do we look out for each other, like the lovely woman who just spoke, and make sure our friends, family, and neighbors have the security of health care?
Yes!
As a nurse, I am well aware of the stress of someone not having your back. My patient, Martin, landed in the hospital needing major surgery right before he started a new job. He had been laid off, as my father had so many times, and therefore no health insurance. Now he has medical bills that could take him decades to pay off. Accepting the funding for Pennsylvania would have helped him and his family. We have patients who are parents working 50-hour weeks split between 3 jobs, so they're, again, no health insurance. They end up coming into our ER and get diagnosed with stage 4 cancer because they can't afford the doctor visit or cancer screening. The inability to get a cancer screening has now left them walking with death. Aren't we better than creating orphans because parents couldn't afford to get a cancer screening?
Yes!
My husband's mother, this is my daughter, Helena. My husband's mother lost her job, she lost her health insurance, and a year later she lost her life. She was only 58. If the expanded Medicaid had been offered at that time, she would have lived to see her grandchildren. Right now, this is the only way my daughter knows her, is by holding her picture instead of her hand. It is as simple as accepting the funding to let Pennsylvanians live to see their grandchildren. Governor Corbett has a choice. He can offer Pennsylvania children the security of knowing their parents can receive health care, or he can put them at risk for becoming orphans. He can honor our greatest generation and maintain their dignity by letting them stay in their own homes, or he can take away their independence and force them into nursing homes. He can create secure and predictable revenue for hospitals and create jobs, or he can put our hospitals and communities at risk. Governor Corbett, lives are on the line.
That's right.
Don't you care? Where is your compassion?
There's none.
Will you be your sister's keeper? Will you be your brother's keeper and accept the funding for Pennsylvania families? Thank you.